I'm Heidi Schofield. I'm a hygienist here at Foothills and River West Dental. I would like to show you today the proper way to take care of your teeth and your gums. When you're toothbrushing, you need to take your toothbrush, and on the top teeth you need to angle it at a 45-degree angle towards the gum tissue. As you're brushing, you don't want to do back and forth motions like this. This will actually cause gum recession and can cause sensitivity to different foods and drinks down the road. What you're going to want to do is do circular motions like this. And you're going to want to work your way slowly around the teeth doing this circular motion. You're going to continue to angle towards the gum tissue and work your way all the way around. On the bottom, you're going to do a very similar motion, but you're going to angle down towards the gum tissue on the bottom. You're going to do circular motions and go ahead and move around the bottom arch this way. It's the same thing on the inside. On the top, you're going to angle towards those top and do circular motions. And then on the bottom, you're going to also angle towards the gum tissue on the bottom and do circular motions. Right up here in the front, sometimes it's really hard to fit a toothbrush in there. You can see that it doesn't fit very well. It's a very narrow area. And so sometimes what you're going to want to do is use the toe of the toothbrush, which is just the top portion. You're going to put it, angle it down towards the gum tissue, just like you have in the other areas. And you're going to do circular motions again, cleaning the back side of those bottom front teeth. Now, when you do the chewing surface of the teeth right here, you're going to want to lay the toothbrush flat on that chewing surface, and you are going to do a back and forth motion, cleaning the food, the plaque, and the debris out of the grooves of the teeth. After you have brushed for 2 minutes, then it's time to do your flossing. There's all different kinds of floss on the market. Right here we have some super floss. Super floss is kind of thick. It looks a little bit like yarn. It's for people that might have orthodontics, or it can also be for people that just have bigger spaces in between their teeth. It helps them to clean that plaque off more thoroughly. We have right here, this is called a floss holder. This can be used with just your regular dental floss, and you wrap the floss around this little button on the front and then up through the grooves and across and down and around the button again. This is used by sliding back and forth gently in between the teeth until the floss moves down, and then you're going to pull towards the front so that you're making a C shape around the front tooth and go up and down, and then you're going to push towards the back so you're making a C shape around the back tooth and move your floss up and down, and then you're going to come out of the teeth. The same motion is used with regular floss. When you do regular flossing, you're going to want to wrap the floss around your index finger or your middle finger, whichever you're more comfortable with. One of the main things with flossing is you want to make sure that you don't snap that floss down, because you can damage the gum tissue by doing that. So you're going to do a seesaw back and forth motion, just like this, putting a little bit of pressure until it goes through the teeth. And then you're going to do the same thing we discussed. We're going to do a C shape around the front tooth, moving the floss up and down, and then we do a C shape around the back tooth, moving the floss up and down. This thoroughly cleans in between the teeth and makes it so you are less likely to have problems with infections of the gum. I have a couple of other tools here. These are what we call our kid flossers, and they actually make these for adults as well. A lot of adults really like to use these because it's less complicated as far as trying to get their fingers to work in their mouth. These you're going to use in the same careful manner. You're going to go ahead and gently slide that down in between the teeth, and then you'll go ahead and floss up and down on both sides, both the front and the back tooth. These are called picks. These are used when maybe you are not consistent with flossing and maybe would prefer to do something more on the go. These work really well if they are used consistently, 1 to 2 times a day. Basically, when you use a pick, you're going to gently slide it in between the teeth and make sure that you cleanse one side of the teeth, or one of the teeth, and then cleanse the other side. so that you're getting both teeth really good. It's also important to make sure that you massage the gum tissue a little bit so that that gum tissue gets some stimulation and stays in a healthy condition. The last thing I have to show you is called a proxy brush. The proxy brush is used for people that have a little wider space in between their teeth. Sometimes when they use dental floss, they're still not able to get all of the plaque out just because of the wider space. This proxy brush has different size of brush tips so that you can use it for larger spaces or small spaces. The way you use the proxy brush is you go ahead and insert it in between the teeth. You're going to move in and out 3, 4, or 5 times. And while you're doing this, you're going to be pushing down on the gum tissue, or if you're working on the top, you're going to be pushing up on the gum tissue in order to give the gum tissue the stimulation that it needs and to cleanse it so that it doesn't become infected. These are the best tools that we have for cleaning your teeth and your gums and maintaining healthy gum tissue and healthy teeth. If you can brush 2 to 3 times a day and then do your flossing at least once a day, then you will be able to maintain a healthy mouth.